To assess for instability, you can examine the patient in the supine or the sitting position. I prefer the sitting position. The anterior apprehension test involves an anterior translational force while bringing the arm into abduction and external rotation. The Jobe relocation test applies a posterior force which stabilizes the joint and allows further movement in that direction. The anterior translation test is assessed by stabilizing the shoulder with one hand while applying an anterior force on the humeral head with the other. This can be assessed on 3 grades. The anterior translation test may be more easily performed in the supine position as demonstrated. The sulcus sign is demonstrated here by applying a downward force on the humerus. In the case of the unstable shoulder, the increase in translation will increase the negative pressure in the joint, causing a concave effect of the shape of the deltoid. Although the majority of shoulder instability is anterior-inferior, it is important to test for multidirectional instability with an inferior applied force with the shoulder and abduction, and for posterior instability, place the arm in forward flexion and abduction with a backward applied force. To complete the examination, we must assess for hyperlaxity. This is done by assessing thumb abduction as demonstrated, scoring 1 point for each side. Finger hyperextension, again scoring 1 point for each side. Elbows hyperextension as demonstrated here with a point given for each side. Knee hyperextension as demonstrated, again scoring 1 point for each side. And finally, asking the patient with the legs straight to touch the floor with the palm of their hands as demonstrated. This is a further point, making the total 9.